Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editors' highlights and a summary of our open access publications available to everyone.
Early detection remains the most powerful intervention in cutaneous oncology, yet it depends on accurate recognition across very different clinical contexts, from rare, rapidly progressive neuroendocrine tumors to common melanocytic lesions that patients first notice at home. This month's selected articles span this spectrum, highlighting practical dermoscopic clues for Merkel cell carcinoma, pragmatic surgical decision-making for anatomically constrained sites, and emerging approaches to melanoma risk stratification and public education. Together, they underscore a single message. Better outcomes require both sharper clinical pattern recognition and clearer, more personalized risk communication.
We begin with Rosendahl et al., who examine one of dermatology's enduring diagnostic challenges, the dermatoscopic characterization of Merkel cell carcinoma. This multi-center study of 134 MCC cases is the largest and most rigorous dermoscopic analysis of Merkel cell carcinoma to date, incorporating control lesions and robust statistical methods. Despite its strong design, the findings were inconclusive. The only positive predictors identified, pink color and scaling, are too common among non-pigmented lesions to be clinically useful, and no discriminatory vessel patterns or white structures were found. As a result, clinical presentation, a rapidly growing pink nodule, remains more diagnostically informative than dermoscopy for MCC, which still cannot be reliably distinguished from amyloidotic melanoma or other non-pigmented malignancies.
Continuing with a viewpoint by Digiacomo et al., we discuss hidradenitis suppurativa and post-arthroplasty wound complications. Hidradenitis suppurativa, HS, is a chronic inflammatory condition that impairs wound healing and may meaningfully affect outcomes after joint arthroplasty, yet it remains underappreciated in perioperative orthopedic planning. Existing evidence is mixed. Some large database studies show significantly elevated risks of wound dehiscence and surgical site infection, while others find no increased complication rates, highlighting the need for prospective multicenter research. In the meantime, the authors advocate for routine inclusion of HS in perioperative risk assessment and a multidisciplinary approach involving dermatologists and orthopedic surgeons, with pre-surgical biologic therapy as a promising strategy to reduce disease activity without raising infection risk.
Another dimension of long-term inflammatory disease management is highlighted in organ transplant recipients. A review by Forster et al. Centers on sirolimus for secondary prevention of CSCC in kidney transplant recipients. Kidney transplant recipients are at increased risk of developing cutaneous squamous cell carcinoma, particularly when treated with calcineurin inhibitors, which are strongly associated with tumorigenesis. In contrast, mTOR inhibitors, such as sirolimus, have demonstrated anti-tumor activity, but their role in secondary prevention of CSCC remains unclear. The authors conducted a systematic review and meta-analysis of randomized controlled trials to evaluate the impact of switching from a calcineurin inhibitors-based to an mTOR inhibitor-based immunosuppressive regimen on the incidence of CSCC. Sirolimus significantly reduced 2-year CSCC incidence. However, discontinuation was more frequent due to adverse effects. No significant differences in mortality or graft rejection were found. In conclusion, sirolimus reduces secondary CSCC risk, but increases to adverse effects. Patient selection and monitoring are essential.
In psoriasis care, long-term, real-world datasets are helping clinicians identify which patients may achieve the most profound and durable responses to targeted therapy. A research paper by Kojanova et al. Assessed super response to guselkumab treatment in patients with moderate to severe psoriasis in the Czech Republic. Guselkumab, a selective interleukin, IL-23 inhibitor, is approved for the treatment of moderate to severe plaque psoriasis. While randomized clinical trials have introduced the concept of super responders, patients achieving complete skin clearance PASI 100 at defined early time points, real-world evidence on their characteristics and long-term outcomes remains limited. This study aimed to identify baseline predictors of super response and to evaluate long-term effectiveness, safety, and drug survival over a 5-year period in a routine clinical setting. This retrospective multicenter study analyzed 435 patients from the Czech BioRep registry treated with guselkumab. Among the cohort, 130 patients, 29.9%, were classified as super responders. Lower body mass index and absence of prior biologic therapy were independent predictors of super responder status, while PASI 75/90/100 rates were significantly higher in super responder. Throughout follow-up, drug survival was comparable between super responders and non-super responders. At 60 months, PASI 100 was maintained in 79.2% super responders versus 35.4% of non-super responders. Obesity and female sex were associated with lower long-term treatment persistence. Super response to guselkumab is linked to distinct baseline features. Despite differences in PASI outcomes, treatment persistence was similar across groups. These findings underscore the value of early identification of super responders and support personalized treatment strategies in clinical practice.
The systemic footprint of hidradenitis suppurativa is explored in a global analysis by Gupta et al. That underscores how geography, lifestyle, and healthcare access may shape the disease's broader comorbidity profile. Hidradenitis suppurativa is a chronic inflammatory skin disorder increasingly recognized as a systemic disease with diverse comorbidities. While several comorbid conditions are well documented, regional differences in prevalence remain unclear. The aim of this study was to evaluate regional variation in major comorbidities among HS patients, including diabetes, hypertension, depression, smoking, thyroid disorders, acne, obesity, psoriasis, and inflammatory bowel disease. Significant regional differences were observed in metabolic, endocrine, and psychiatric comorbidities. North American patients had higher odds of diabetes compared to Europe and hypertension compared to the Middle East/Asia. Depression and thyroid disorders were more common in North America and Europe compared to the Middle East/Asia. Smoking was more prevalent in Europe compared to North America and the Middle East/Asia. Among pediatric patients, anxiety and depression were more common in North America, while smoking was more frequent outside North America. Regional variation in comorbidity prevalence likely reflects differences in lifestyle, diet, sociocultural norms, healthcare literacy, and access to care. Recognizing these patterns may support earlier identification, guide preventive efforts, and inform individualized management strategies in hidradenitis suppurativa.
A study by Tran et al. Places emphasis on refining risk recognition and challenges the limitations of conventional melanoma stratification tools. The Fitzpatrick skin type is commonly used in clinical settings to stratify melanoma risk across different skin types. However, it is subjective and does not capture intratype variability in risk. These limitations are particularly evident among lighter-skinned individuals, who constitute the majority of those with European ancestry and generally have a higher melanoma risk. The authors assessed whether supplementing Fitzpatrick skin type with validated polygenic scores for skin color and polygenic scores for melanoma improves risk stratification in UK Biobank participants. The authors found that integrating polygenic scores for skin color and melanoma with the conventional Fitzpatrick skin type classification significantly improves melanoma risk stratification and addresses key limitations of the Fitzpatrick skin type, which, while widely used, lacks sensitivity to intratype risk variation.
A short communication by Broniczki et al. Summarizes the effects of GLP-1 receptor agonists on hair loss and regrowth. This systematic review examined the relationship between GLP-1 receptor agonists and hair outcomes across nearly 1 million adverse event reports in several cohort studies, finding that roughly 1.6% of GLP-1 RA users experienced hair loss, while hair regrowth was rare but documented. Pharmacovigilance data showed a weak association between GLP-1 RA use, most notably semaglutide and tirzepatide, and alopecia, though disproportionality analyses were inconsistent and reporting bias limits firm conclusions. Proposed mechanisms include rapid weight loss, hormonal shifts, and nutritional deficiencies, while some hair loss subtypes like CCCA and AGA showed potential for improvement with better metabolic control. Larger prospective studies are needed to clarify causality and identify which patients are most at risk or most likely to benefit.
Further, Garcia, Nunez, et al. Kawasi present the predictive factors of response and real-world experience of baricitinib in alopecia areata. In this real-world single-center study of 72 patients, approximately half achieved a meaningful response to baricitinib for severe alopecia areata, with response rates continuing to climb over 2 years of follow-up. Multivariate analysis identified lower baseline disease severity, shorter disease duration, and longer treatment duration as significant predictors of response, while sex, nail involvement, and immune-mediated comorbidities did not reach statistical significance. The authors conclude that baricitinib is effective and safe in routine care, and that these predictors, representing the largest such multivariate analysis in a European population to date, can help guide patient selection and support sustained treatment persistence.
Next, Bratico et al. Compared the clinical and dermoscopic features of micronodular and nodular basal cell carcinoma in the largest dermoscopic analysis of this aggressive subtype to date. This large retrospective study compared dermoscopic features of 105 micronodular BCCs and 102 nodular BCCs, finding that MBCC was characterized by significantly greater vascularization, with branched vessels covering more than half the lesion in nearly 60% of cases, and fewer erosions, while pigmentation patterns did not differ meaningfully between subtypes. Surgical outcomes trended toward worse results in MBCC, with higher rates of positive margins and all local relapses occurring in the MBCC group, though these differences did not reach statistical significance over the 2-year follow-up. The authors conclude that recognizing these dermoscopic vascular features may help clinicians suspect MBCC preoperatively and plan more careful surgical management, representing the largest dermoscopic analysis of this aggressive subtype to date.
In their paper, Dottolo et al. Advocate for routine screening for psychological morbidity in atopic dermatitis. This cross-sectional study of 132 adult AD patients found substantial psychosocial burden across multiple validated measures, with nearly 40% screening positive for potential anxiety or depression, and worse outcomes consistently linked to female sex, facial or hand involvement, longer disease duration, and greater clinical severity. Dupilumab-treated patients reported meaningfully lower impairment across quality of life scales, suggesting that effective disease control may also ease psychological burden. The authors call for routine psychopathological screening in AD care and a multidisciplinary approach that addresses mental health alongside skin disease, with prospective studies needed to determine whether managing psychiatric comorbidities improves dermatological outcomes.
In our surgical pearls section, Leopolis et al. Describe a creative solution for columellar repair following excision of infiltrating basal cell carcinoma. A 65-year-old woman with a BCC on the columella underwent surgical excision that left a full-thickness vertical defect, which was repaired using a novel bilateral H-shaped advancement flap, a single-stage technique not previously described for this anatomical site. The approach involved wide subcutaneous undermining with opposing superior and inferior flap advancement to achieve tension-free closure while preserving vascularity, with incisions placed along natural aesthetic boundaries to minimize visible scarring. At 6-month follow-up, the patient had excellent functional and cosmetic outcomes, and the authors proposed this technique as a practical, single-stage alternative to more complex regional flaps or multi-stage procedures for columellar reconstruction.
Lastly, in a letter to the editor, Tan et al. Evaluate the neuropsychiatric outcomes of IL-17 and IL-23 inhibitors in dermatology. IL-17 and IL-23 inhibitors are generally well tolerated neuropsychiatrically, with most agents showing low rates of depression and no significant suicidality signal. The notable exception being brodalumab, which carries an FDA-boxed warning for rare completed suicides, largely in patients with pre-existing psychiatric vulnerability. Beyond safety, these biologics may indirectly improve mood, fatigue, and sleep by reducing systemic inflammation and the psychosocial burden of visible skin disease, with mechanistic evidence suggesting that cytokine blockade can modulate neuroimmune pathways, including microglial activation and hippocampal synaptic function. The authors of this paper recommend structured baseline psychiatric screening and longitudinal monitoring, particularly for higher-risk subgroups such as adolescents and those with comorbid depression, and call for prospective trials with dedicated neuropsychiatric endpoints to better define CNS effects and guide individualized treatment decisions.
We hope this episode has offered fresh perspectives you can bring into your own work. To explore these articles in full, visit the International Journal of Dermatology online. Thank you for joining us for this episode of IJD in Focus. Until next time, stay informed and curious.